Hi, I'm Dr. Wilhelm. I've been doing retina and general ophthalmology with Lansing LO Care for a number of years. We're now here at the Okemos office. Dr. Lou and I have recently moved here to open up the office. We decided on the Okemos office because we wanted to get a little more coverage of our patients in the Okemos area, and Central Park is conveniently for that. As you're aware, LO Care is a number of locations. We have 11 different offices throughout mid-Michigan. We go from north at Mount Pleasant, south down to Lansing, east to Howell, and west to Lake Odessa. One of the things we're looking forward to is that on April 26th, we're going to have an open house here at the Okemos office. For those people who come to help celebrate with us, they will be getting a receipt for $50 off of a pair of glasses at the Okemos locations, and this will be throughout the day. And the program that will officially occur between 5 and 7 o'clock with a ribbon cutting ceremony at 6 o'clock. So if you have the time to come and visit us, why, I think you'll enjoy looking through our optical shop and seeing the new offices here. And at this Okemos location, we're going to have all the areas of ophthalmology. We'll have cornea, general ophthalmology, cataract surgery, glaucoma surgery, retinal detachment evaluations, and diabetic evaluations.
Good. So we do have a few questions coming in about the general eye health, and so we'll go ahead into the Q&A portion. Our first question is from Kylie. She says, if I can see without glasses, do I really need to have an eye exam?
For people who see well without glasses, it depends upon what else is going on in their health. People who are diabetics should have a regular yearly evaluation because diabetes can affect the eyes, and you want to know whether or not that is starting to occur. For people who have a family history of their parents or grandparents with glaucoma, then they also should periodically have their eyes evaluated for glaucoma. There are other people who have a family history of retinal detachments or retinal tears, and those people should also be seen to check to see if they're developing any retinal tears in the retina like that. So just because you're seeing well doesn't mean you should never have an eye exam. There are certain people that definitely a screening exam is good to have.
And what does it mean to have 20/20 vision in one eye versus 20/40 in another eye?
Okay, with 20/20 vision, you're seeing a reference distance of 20 feet. And if you say like you're seeing 20/40, it means that a person with 20/20 vision could see what you see at 20 feet at 40 feet. And if you're saying like 2100, the 20/20 person could see that at 100 feet, whereas you're only seeing it at 20 feet.
Okay, makes sense. Can eyes be transplanted like lungs or kidneys?
The entire eye cannot be transplanted at this point. However, the cornea, which is the clear part of the front of the eye, has been transplanted for a number of years and actually is one of the most commonly transplanted parts of the body that we do today.
Okay. Why does my eye twitch, and how can somebody make that stop?
Well, the most common reason for why the eye twitches is they have anxiety or pressure, and if they relax, that usually goes away. There are some people that have it constantly, and for those people who have it constantly for like 6 months at a time, then you can have Botox injections to stop that.
Okay. And will sitting really close to the TV hurt children's eyes?
No, they may not be able to see all of the whole picture, but it's not going to damage their eyes.
Right. Another question is from Hayden, and what should young people be doing to help keep their eyes healthy throughout their lives?
Well, For trying to keep your eyes healthy, you need a good regular diet, and you need to have your vitamins so that you get the proper amount of vitamins, because like your vitamin A is important too, and your vitamin C, those are important things for your eyes. And then your green leafy vegetables, you have your lutein and zeaxanthin and your carotenoids. They help your center of vision continue to function well. From the practical point of view of when you're working around high-speed equipment, drills, saws, or like that, then you should have protective goggles on. And if you're using air guns or nailers, you should also have protective goggles on, because sometimes they hit things and bounce back in your face, so you're wanting to avoid injury to the eyes.
And Derek asks, what are floaters in my eyes, and why do people have them?
What you notice as a floater is sort of a dark object, or sometimes it's semi-lucent object that goes across your vision. And this occurs because there's a little thicker area in the gel inside the eye. As we get older, or people who have very nearsighted eyes, the gel starts to thin out. And when you're born, it's like hard jello, it's very solid. And as we age, it becomes more like jello that sat in the sun. It becomes more liquid. But it's still, you have cells or fibers within the gel, and these areas that are thicker, then there are different contrasts. So when they go across your line of sight, you see around them better than you see through them, so that it stands out, and you see it because of that difference in contrast. It's like when you put a drop of oil in water, you notice it because it's a different density, and you see the contrast there. And this happens as we get older, and it also happens earlier in people who are more nearsighted.
Another question is, this is one everybody wants to know, is will reading or working in dim light hurt my eyes?
You may not see very well, but it's not going to hurt your eyes.
Okay. What about, somebody wants to know, my friend has worn the same pair of glasses for the last few years. Can wearing the wrong prescription hurt your eyes?
Well, the wrong prescription just means that it doesn't focus the light at the best focus point on your center of vision. And it means your vision is just a little blurred. It's not going to damage the eye, it just means you aren't seeing as sharp as you could see.
And how do you, say somebody does get metal in their eye from not wearing protective glasses over, how do they get metal out of the eye if that does happen?
Okay. If it's stuck on the cornea, the clear part of the eye, we first put anesthetic drops on the eye, and you can use special little instruments to remove the foreign body itself. And if there's any rust rings or like that, then there are other instruments that we use to remove the rust that's there in the cornea.
Okay. Is it true that if you eat carrots, you will not have to wear glasses?
No, it's not. It may help you so you don't have the, severe dry eyes, but it's not going to make so you won't have to wear glasses.
Okay. How concerned should I be when I have trouble focusing from near to far?
Well, for the most part, it just means your ability to focus or accommodate is less, and it's not responding as quickly. As we get older, we lose that accommodation, and that's why people start pushing things further out when they want to read, and eventually they go into reading glasses for that. And that's why you have that distance going in and out, as you're not accommodating as well.
Okay. And will looking at my phone in the dark hurt my eyes?
No. When you look away in the distance, you may be a little blurred until you can readjust, but looking at it won't hurt.
Okay. If I have LASIK, will I still need to have cataract surgery eventually too?
Yes, because LASIK is changing the shape of the cornea, or the surface of the eye, and when it does that, it changes your refraction, or the need for glasses for distance correction, and it does not have any effect on the lens of the eye. And the lens, as we get older, starts to become hazier, and eventually it interferes with how well you see. And this occurs at different ages in people, and once it interferes significantly enough with their vision, then they consider cataract surgery.
If somebody sleeps in their contacts, which, you know, some people just fall asleep with them in, what harm can that do to their eyes?
It depends on the type of contact that they have. There are certain contacts that are designed to be able to sleep in, and these are more oxygen permeable than other contacts. In the past, when contacts were designed just for daily wear, wearing them at night or sleeping in them did not allow the cornea surface to get enough oxygen to maintain good health. And then those cells would swell up, and if they swell up enough, then when you remove the contact, you would remove the central portion of your cornea, causing a corneal abrasion. So the reason for not sleeping in your contacts is to prevent damage to the surface of the cornea.
What does it mean to have astigmatism, and are astigmatisms treatable?
The astigmatism, if you think of a basketball, you have the same curve in all directions. And a football has different curves in different directions. Football, those different curves are called astigmatism, whereas the basketball is a sphere. And what that means for the eye is that as the light comes in the eye, instead of being all the light rays focused at one point, they're focused at different points. So your vision is blurred in one axis, one direction. How much that bothers you depends upon how large the astigmatism is and what direction it is. The most common way of correcting that is with glasses, although sometimes people decide to wear contacts and they can correct it with that. And when you have LASIK, why that would something that would be corrected with your nearsightedness. And we also, in people who have cataract surgery that have significant astigmatism, they have special lens implants that will partially correct some of that astigmatism.
Interesting. Do you, like, why do some people get matter into the, like, in their corner of their eyes, maybe when they wake up or throughout the day?
Yeah, it depends upon the age of the person. For people under the age of 50, some of them have mild allergies, and so they collect, you have a normal secretion in response to something that you're allergic to, and you have a little collection in the corner of the eye. The other thing that occurs is that your oil glands surface the eye. They can become partially blocked and become infected, and if it's not an aggressive organism, you may have just a little mild infection, and that will cause some debris to build up on the cornea. In people who are over the age of 60, the most common cause of a little crusting in the corner is that your tears at night, they flush the debris when you blink on the surface of the eye and dust that blows in the eye towards your tear ducts in the corner. And if you don't have enough tears and you're laying on the side and their tears have to go uphill, then you don't have the drainage to carry away all that debris. You can build up little deposits in the corner of your eye.
That's interesting. Another question that we have is, why in glaucoma do you lose your side vision first?
The pressure of the eye has an effect on the part of the optic nerve that damages the edge of the vision first, and it's only late in disease that it becomes in the central part. And the reason for that is just the structural way of the eye and the optic nerve and the parts that do not move very well, that are stiff, and then you're pushing this tissue against that stiff tissue, and that's the part that gets damaged first.
And Brittany wants to know, my eyes burn when I focus on a book or a computer for a long time. What can I do to make that burning stop?
When you're reading, you don't blink as often, and if your tear production is low, then the surface of the eye starts to dry out. So if you're burning or irritation when you're reading, you can either take a break and blink your eyes frequently, or you can use some artificial tears that you can get over the counter to put in the eye, and that will recoat the surface of the eye and then be more comfortable.
And Amber is asking, if I have my cataracts removed, will they ever come back?
When you remove the inside of the cataract, you leave the shell in place. And there's always a few cells that sort of try to make a new lens, and they get little fibrous tissue, so that shell can become hazy. And when it becomes hazy enough, then you take a special laser and put an opening in that shell so the light can get back to the eye again.
And somebody's asking, my eyes feel dry at the end of the day from staring at my computer screen all day long. What can somebody do to help that?
Well, it's the same as when you're reading a book. You're staring at the computer screen, you're concentrating, especially if the screen's got small font, and you're not blinking as much, so the surface dries out. You should either close your eyes and take little breaks periodically during the computer work, or you can use some artificial tears. They make different thicknesses or viscosity tears, and some work better for some people than others, and you can use those as often as you want during the day.
What happens to your eye when you strain too hard, like from lifting something heavy? Can your eyes ever really pop out?
Well, for about 99% of the population, that's not going to happen. There are some thyroid disease patients where the muscles of the eye start to swell and it pushes the eye forward. And if they have very severe thyroid eye disease, then yes, it is possible that they could strain and pop them out. But for most people, no.
Okay, very good. And Anna says, MSC is here watching. Nice job, Dr. Wilhelm. Corey. You have some fans out there. So another question is, what is the difference between wet macular degeneration or dry macular degeneration? And can you have both?
In macular degeneration, you have deterioration of the retina around your center of vision. Initially, you have the dry part where you have accumulation of the breakdown products of the rods and cones that are not carried away like they used to be when the eye was younger. This here builds up in levels that are toxic to the cells there, and they start to damage the cells so they don't work as well. And this is your dry macular degeneration. Now, some of the patients with dry macular degeneration develop enough damage to the outer layers of the retina that new blood vessels start to grow. And these new blood vessels, we call that wet macular degeneration. So you can have both types at the same time. And when the wet macular degeneration, these new blood vessels can either leak fluid or else they can bleed. If they leak fluid, then the retina swells up, and we have injections that we can use to decrease the leakage of fluid. The retina's swelling is less, and you often get a good improvement in the vision. In people who bleed, the retina also swells, but it's because of blood. It's like when you bruise yourself, you have a bulging there of your center of vision, and the problem is with the iron in the blood, it's damaging to the cells, and many times that vision doesn't return if it's directly beneath your center of vision.
Okay. And how often should somebody get a dilated exam?
Okay, and when you're young, you can do it about every 10 years or so. Once you get over the age of 60, they suggest yearly, because as you get older, the rate of problems from macular degeneration starts to increase. You have cataracts that develop. Your risk of glaucoma increases, and you want to see whether or not everything inside the eye is doing well.
And somebody's asking, I had a stroke of the optic nerve, in the optic nerve around July last year. Now there's a gray area below my point of focus. Will that ever go away?
Since it's been, over 6 months, probably not. And when you have that stroke, you have damage to the parts of the optic nerve, and sometimes that swelling goes down and the nerve starts to function better. But when it doesn't function better, after 6 months, then those are usually permanent changes.
Great. Very good. We have a lot of questions. People, you can still comment throughout the day, and we'll get those answered for all of you as well. But thank you so much for joining us.
You're welcome.